Hey, hello everybody. I'm Dana Burnett with WorldLink Medical, and I'm back here with Christy Hales, our clinical pharmacy educator. Today we're going to take a deeper dive into actually part one of the series. I think it might be really helpful. We know that some of you are already doing hormone therapy. Some of you may be doing it, not getting the results you expect. So we're going to talk a little bit about that, and then we'll let you know what we're actually going to be discussing in part one. It might be helpful, Christy, in the beginning to let us know what's fundamentally the difference between synthetic and bioidentical. I think a lot of people actually don't even know that.
Well, the synthetic structure is manufactured in a lab. The body doesn't recognize it as the same chemical that it makes. So in a woman's body, we make estradiol in our ovaries, and the hormones that WorldLink Medical teaches would replace those same hormones with the same chemical structure. The body recognizes it and knows what to do with it. Now, in a synthetic structure, the body looks at it and says, I don't know what to do with this. It doesn't fit quite right in the receptors. It doesn't quite have the same response. And when that happens, you get some really weird side effects that people are expecting from hormones because of the synthetic hormones. The natural fits into that receptor well, the body knows what to do with it, and it's just a beautiful symphony that plays in our body every day when they're optimized.
Great. I know that there are different ways to prescribe hormone replacement therapy, and I think there's a lot of confusion around why and what that looks like. And I think some organizations tend to teach more symptom control, right? Somebody has a hot flash, then they're going to be prescribed hormones. It's going to get rid of the hot flashes. But I think here at this academy, we're really more focused on the long-term therapeutic goals. Can you kind of talk to us a little bit about the differences with that?
Yes, I remember watching a podcast where a provider talked about, how debilitating these hot flashes could be for a woman. And I thought, well, how debilitating can 100 other things be? Just the symptom control of the hot flash alone is not really the main problem that happens when we lose our hormones. It's the body's way of saying, help me. I don't have these crucial hormones anymore. And when our body loses that, we see the hot flash. But really, it's a cry for help for the other things. And in WorldLink Medical, we're taught that we can help many other symptoms other than that hot flash, like preventing cardiovascular disease, preventing bone loss, preventing dementia and Alzheimer's. And that's what's so revolutionary about WorldLink, is that we're not just controlling symptoms of maybe low libido or symptoms of fatigue, hot flashes, night sweats, but we're changing outcomes of these major disease states.
Okay. Why do you think so many people are so afraid of hormone replacement therapy? Why does it have such a bad mark on it?
Because I think the WHI study caused a lot of issues, and the synthetic do cause problems. I refer this to a lot of providers to where, you see a commercial for a manufactured drug and it has one symptom that it helps, and it's a really short symptom. But the side effects are so long, they have to speed it up. And hormones are the opposite. There might be a little small bump in the road, but the benefits are so long, we would have to speed it up. Patients are seeking this out. It's whether they get the results they want. And the problem is so many other academies teach it differently that they don't get the results that they want. And so they seek it out till they find a provider, which is why so many patients are looking for WorldLink providers.
Great. Can you talk to us a little bit about what are the hormones that we're going to cover in part one? What does that look like? What does that weekend actually look like?
That weekend is packed full of the most eventful weekend at any conference I've ever had. Be prepared to come and learn. Be prepared to be blown away. Be prepared to understand that we talk about testosterone and the benefits in women, for bone density, for fatigue, and for anxiety even. We talk about testosterone for men and the benefit it has for not only sexual function, but their overall, andropausal symptoms. We talk about thyroid and for men and women when it needs to be optimized versus just treating symptoms of fatigue. We talk about progesterone and progesterone's benefit in PCOS patients and in perimenopause patients. Perimenopause is a rough state to go through, and the real treatment is progesterone, and you learn about that. I love learning about melatonin and its benefits, as well as all the other hormones that are a little bit more minor but helpful as well.
Great. And really what you can expect then is how to dose it, monitor it, adjust it, no side effects, contraindications. We get you hooked into the platform, so you've got a community of providers as well as access to Christy. It's a new platform we're super excited about, and it really helps give you confidence that you're not just here to take a course and then we're going to leave you. So in this instance, we're here for the duration, whether it's through your attendance at the 4-part series and long after. It's a great community. We'll hope you consider joining us at an upcoming event. Thank you so much.
Thank you.